Sleep is an essential part of everyone's life. One of the most important aspects of sleep is its impact on brain function during sleep. Our brain actively processes information from the day and strengthens our memory. Additionally, healthy sleep helps restore our physical condition. During sleep, tissues that were damaged during the day are regenerated and repaired. Research shows that lack of sleep can affect our health and increase the risk of various diseases, including cardiovascular diseases, diabetes, obesity, and even cancer. The quality of sleep depends on the position in which a person falls asleep. While the body can change position during sleep, we spend most of the time in the position we initially fell asleep in. People typically sleep on their side back or stomach changing. Sleep habits can be difficult, but is possible. It's important to understand that an incorrect sleep position can cause discomfort and worsen overall well-being. Subscribe to the channel. Discovering the best sleeping position is more than just a matter of comfort. It's a pivotal aspect of maintaining optimal heart health. In the fast-paced world we live in, a good night's sleep has become a luxury rather than a necessity. Yet, the quality of your sleep, including your sleeping position, can have profound effects on your overall health. Issues such as insomnia, elevated blood pressure, a risk of heart attack, and the development of sleep apnea are all intricately tied to how well and in what position you sleep. Addressing your sleep habits can be an essential step in safeguarding your heart and ensuring your well-being. This video will explore the connection between sleep and heart health, shedding light on the best sleeping positions that may help mitigate the risk of heart-related complications. We will delve into how poor sleep positions can exacerbate or lead to health issues like high blood pressure and sleep apnea. Moreover, we will discuss the broader implications of insufficient sleep and sleep disorders, alongside providing actionable advice on developing healthy sleep habits. The overlooked link between nutrition and sleep, along with the role of physical activity in enhancing sleep quality, will also be examined. By the conclusion, you'll have a comprehensive understanding of how to sleep like a baby and protect your heart, aligning your sleep practices for optimal health and vitality. The connection between sleep and heart health. Understanding the intricate relationship between sleep and heart health is crucial. Cardiovascular disease remains a leading cause of death globally, with deaths expected to surpass 24 million by 2031. Your sleep quality and duration play a significant role in cardiovascular health, influencing everything from heart disease risk to your daily functioning. Sleep quality and cardiovascular risk. Research indicates that both sleep quality and duration are critical in managing heart health. Poor sleep quality has been consistently linked with a higher risk of cardiovascular diseases. This includes conditions like high blood pressure and coronary heart disease. Notably, studies have found that poor sleep quality and short sleep durations are independently associated with an increased risk of coronary heart disease events in adults aged 40 and older. The impact of sleep duration. While the quality of sleep is essential, the duration of sleep also holds significant weight in cardiovascular health. Short sleep duration has been shown to increase the risk of cardiovascular diseases. 1. Interestingly, long sleep durations of more than 8 hours per day might also pose health risks, although the effects are less clear and sometimes do not reach statistical significance. 1. Mechanisms linking poor sleep to heart health. Several mechanisms could explain the detrimental effects of poor sleep on heart health. Disrupted sleep can lead to changes in hormones like leptin and ghrelin, which influence hunger and satiety, potentially leading to obesity, a risk factor for cardiovascular disease. 1. Additionally, sleep deprivation may increase cortisol secretion and alter growth hormone metabolism, contributing to high blood pressure and cardiovascular strain. 1. The role of sleep in regulating blood pressure. During healthy sleep, particularly in the non-rapid eye movement, NREM stages, your heart rate slows and your blood pressure drops too. this nocturnal dipping is crucial for cardiovascular health. Lack of sleep can prevent this natural decline in blood pressure, leading to increased cardiovascular risks, including higher overall blood pressure and a greater likelihood of heart attacks and strokes too. Sleep disorders and cardiovascular health conditions. Like sleep apnea and insomnia not only disrupt sleep, but also have direct implications on heart health. Sleep apnea, for instance, is strongly linked with hypertension, heart failure, and other cardiovascular diseases. 2. Managing these sleep disorders is vital for maintaining overall cardiovascular health and preventing potential heart complications. By prioritizing good sleep hygiene and addressing sleep disorders, you can significantly impact your heart health. Ensuring you get enough quality sleep is a manageable and crucial step towards reducing your risk of cardiovascular diseases. Identifying the best sleep positions, the right side versus the left side. When considering the best sleeping position for heart health, there's ongoing debate about whether sleeping on your left or right side is more beneficial. Some evidence suggests that sleeping on your left side may increase pressure on your heart, potentially altering your heart's electrical activity. Though it does not increase the risk of developing heart conditions if none are pre-existing. Conversely, sleeping on your right side might compress your vena cava, the vein that feeds into your heart. But currently, there is no substantial evidence to show that this increases the risk of heart failure. For individuals with heart failure, sleeping on the right side may be advised as it is generally considered safe and could potentially be more comfortable, especially if an implantable cardioverter defibrillator, ICD, is present on the left side. Positions to avoid. Certain sleeping positions may exacerbate existing health issues or lead to discomfort. For instance, sleeping on your stomach might help alleviate snoring and symptoms of sleep apnea, but it can also cause neck and back pain. Notably, individuals with congestive heart failure may experience increased discomfort and breathing difficulties when lying on their left side. Furthermore, lying on your back may lead to lung congestion in those with congestive heart failure, making it necessary to sleep with the head elevated or to avoid this position altogether. For those managing specific heart conditions or devices like ICDs, it's crucial to consult with healthcare providers to determine the most suitable sleeping positions to avoid any adverse effects on health. How poor sleep affects your heart. Chronic sleep deprivation is alarmingly common, with approximately 1 in 3 adults getting less than the recommended 7 hours per night. This lack of sleep significantly impacts cardiovascular function, leading to higher than average blood pressure levels and increased strain on the heart and blood vessels. Furthermore, studies have shown that adults who consistently sleep 5 hours or less per night have a 200% to 300% higher risk of coronary artery calcification, a critical indicator of potential heart disease. The sympathetic nervous system, often referred to as the fight or flight system, becomes more active with insufficient sleep, resulting in elevated levels of adrenaline and cortisol. These changes contribute to higher risks of developing heart disease. Additionally, short sleep duration has been independently associated with various cardiovascular risks, including hypertension and diabetes mellitus, due to increased sympathetic nervous system activity. Poor sleep quality and heart diseases. Poor sleep quality can exacerbate or lead to serious cardiovascular diseases. Disrupted sleep cycles affect the body's ability to regulate critical hormones like leptin and ghrelin, leading to weight gain and increased risk of heart disease and diabetes. 5. Sleep deprivation also elevates cortisol levels, further contributing to cardiovascular strain. Moreover, sleep disorders such as sleep apnea significantly affect heart health. Untreated sleep apnea can lead to high blood pressure, heart problems, and type 2 diabetes. It is particularly concerning as it can trigger heart rhythm disorders, like atrial fibrillation, which are exacerbated by poor sleep. Sleep deprivation is not just about quantity, but also quality. Insufficient or irregular sleep can negatively influence diet, stress, and other lifestyle factors, raising the risk of cardiovascular disease. Excessive daytime sleepiness, a symptom of many sleep disorders, has also been linked to a greater risk of cardiovascular issues due to increased inflammation in the body. In conclusion, managing sleep quality and duration is crucial for heart health. Consulting healthcare providers for proper diagnosis and treatment of sleep disorders is essential to mitigate these risks and promote overall cardiovascular health. Environmental factors. Your sleeping environment plays a pivotal role in the quality of your sleep, which in turn affects heart health. Factors such as artificial light, environmental noise, and air quality can disrupt sleep patterns and contribute to sleep disorders. To foster optimal sleep, it is advisable to minimize exposure to artificial light and noise by using blackout curtains and soundproofing your bedroom if necessary. Studies have shown that exposure to natural environments, such as areas with green spaces or water features, correlates with better sleep health. These settings not only promote relaxation, but also encourage physical activities such as walking, which can further enhance sleep quality 15. On the other hand, urban environments with high noise levels and light pollution can lead to sleep disturbances, impacting both the duration and quality of sleep. Moreover, maintaining a comfortable bedroom temperature and reducing indoor air pollution can also contribute to better sleep health. For instance, avoiding the use of biofuels indoors can decrease the risk of respiratory irritations that might disrupt sleep, particularly in children. By addressing these environmental factors and establishing a conducive sleep routine, you can significantly improve your sleep quality, thereby supporting your heart health and overall well-being.